Hello, good afternoon. Still Dr. Trudy Ufondu. I apologize for the disconnection. For some reasons, the chat just disconnected, but I'm back again, and we're talking about polycystic ovarian syndrome. Polycystic ovarian syndrome. So please, when you join, let me know if you can see me this time. Okay, I can see COO. COO, thank you so much. So let's all quickly rally again. I think the last stream, we had about 10 people in the clinic. So please, when you join, introduce yourself. Let me know where you are, and I will continue my conversation. I'm actually going to start from the beginning, okay? So I apologize. We're talking about polycystic ovarian syndrome. Very important condition that can affect a lot of our members. And I was trying to walk you guys through on how you can become pregnant. So the essence of today's broadcast is to help women with polycystic ovarian syndrome so they can become pregnant. So please, once you join, indicate. I can see Chinyere, I can see COO. Previously, Dr. Ndiche was in the clinic, Mahaneli, and a couple of other people. So please, if you can see me, just give me a thumbs up. COO, just still type a thumbs up. Chinyere, type a thumbs up so I will confirm that I'm okay now. Okay, I can see Tosi, I can see Mahaneli. Awesome, guys. So keep sharing this link so that other people can join. This is very, very important clinic. Now, so many women will have polycystic ovarian syndrome and they won't even know. So it's important we diagnose it properly. Polycystic ovarian syndrome is a known player in infertility. Infertility is the inability to become pregnant after a period of 12 months. If you're below 35 and you're making love regularly without protection and you were not able to become pregnant, or you are above 35, after a period of 6 months, you're not pregnant. Polycystic ovarian syndrome is one of the biggest players in causing infertility in women. Why? Because in polycystic ovarian syndrome, women ordinarily should have more female-dominated hormones like estrogen, progesterone, FSH, LH, but they will have more androgens. Androgens are more male-dominated hormones. For example, testosterone. When women have this testosterone in higher level, it will suppress the process of ovulation. So the women will not be developing the follicles that will burst open and you release your egg. Instead of developing those burst follicles, the eggs will start accumulating, the follicles will start accumulating, and the more they accumulate, the more they have fluid in it, leading to the condition of polycystic ovaries. So if you notice this cross-section of polycystic ovaries, when you go to the ovaries, you have multiple follicles which could not ovulate. So women that have polycystic ovarian syndrome will have absence of bleeding or irregular bleeding and complete absence of ovulation. Remembering that when you can ovulate, you can become pregnant. So at the center of polycystic ovarian syndrome is lack of ovulation, lack of regular bleeding, irregular bleeding. Very big problem. Now, majority of women that have polycystic ovarian syndrome will also have insulin resistance. So insulin is a hormone that will normally handle your blood sugar. So when you have a lot of resistance to insulin, your body will not handle sugar properly, and it will also contribute to your infertility. This is why we normally treat women that have polycystic ovarian syndrome with metformin, a drug we'll normally give people that have diabetes. Now, another presentation when you have this increase in androgens is appearance of facial hairs. Scalp, you go to your scalp, you discover you're losing hairs. In women, presence of pimple and acne all over your face suddenly. These are presentations you might have polycystic ovarian syndrome. So there are 3 things we must have to diagnose polycystic ovarian syndrome. Lack of period or irregular period, which can also mean you are not ovulating. Presence of high level of your androgens. Your estrogen, your testosterone level is higher than expected. Then when we go to your ovaries, the cross-section of your ovaries will give us a presentation of polycystic ovaries. When we have this, then we will diagnose you as a woman with polycystic ovarian syndrome. Now, thankfully, we are in the era of grace. So there are a couple of things we can do medically to help women that have polycystic ovarian syndrome to become pregnant. And I mentioned that number one is medication. Because we've noticed that your testosterone level is high, we will give you ovulation induction drugs. Drugs like your clomid, letrozole, and other gonadotropins, so we can help your body to ovulate because you're not ovulating. So the first line of treatment of women with polycystic ovarian syndrome is what? Medications. Fertility medication is not a medication you can take by yourself. You have to establish with a fertility specialist so we can carefully give you the dose you need and the number of days you need them. So fertility medication is number one. The essence is to establish your ovulation again. Number two, we have to find your healthy body weight. So everybody in this clinic today should be conversant with their BMI. In women that have polycystic ovarian syndrome, majority of them have BMI from 25 and above. When your BMI is from 25 and above up to below 30, you have overweight. You have a problem. When your BMI is above 30, you have obesity, you have a problem. If you can lose 10% of your body weight, your hormones will improve. You will likely ovulate. Even 5% weight loss can lead to a lot of improvement. Now, in one recent study, we discovered that women that exercise regularly will have a 5% lower risk of infertility. So please work on what you eat. Exercise, avoid stress. It will help to improve your chance of becoming pregnant. And of course, if you're taking this hormonal medication, if you're losing a lot of body weight, if you're eating healthy, if you're sleeping, what else are you supposed to do? Regular lovemaking, possibly every day. So the more you engage in lovemaking, the more you're increasing your chance. Number three, you must reduce your stress. So if you have polycystic ovarian syndrome, please avoid stress. When you reduce stress, you will help your hormones to perform optimally. You will help your body to adjust optimally, especially long-term stress. Long-term chronic stress can put a strain on your fertility, on your hormones. Why? Because when you're stressing, you're producing a lot of cortisol. Cortisol is a stress hormone. When you have a high level of cortisol, it can affect your ability to ovulate. It can increase the level of your insulin, and that will cause a problem. So women that have polycystic ovarian syndrome must relax. When you're done taking your drugs, when you're drinking your water, when you're exercising, when you're eating good food, you must sleep. You must avoid stress. The less stressed you are, the more you're improving your hormones, the more you're likely gonna ovulate. Now, unfortunately, some women will take the drugs, some women will lose weight, some women will avoid stress, and they will still not become pregnant. What do we do next? We go for assisted reproductive technologies. Things like your IVF, things like your IUI, things like your ICSI. If the natural way fails, we'll resort to helping you to become pregnant. So if ovulation medication do not improve your fertility, we are going to try you on IVF. And it works. Studies have found that women that have polycystic ovarian syndrome that go for IVF will have the same success story compared to women without the condition. The only other problem, if we confirm you are not ovulating, if you're going for IVF, you will go for IVF with what? Donor eggs. Number 5, and the last point, some women will benefit from surgical option. There's a particular surgical technique we call ovarian drilling. So we carefully go to your ovaries and we trigger ovulation by doing some minor drilling in the ovaries to help to improve your possibility of ovulating. So some women will benefit from surgical ovarian drilling to boost your fertility. It's called ovarian drilling to trigger ovulation. So if that's your option, we'll do that. Now, some women, we might not even have a need to do ovarian drilling because up to 50% of time, They discover that when you do this, it might not really help. So the best option right now, if you have polycystic ovarian syndrome and it's not responsive, is to meet a fertility specialist. We can start you on drugs. We can watch your body weight. We can work on your stress. And if all fails, we go to IVF. But just know the fact that you have polycystic ovarian syndrome doesn't mean you can't become pregnant. You can still become pregnant and you can still be a mother. The condition can complicate your pregnancy. So when you are pregnant, we also monitor you closely to make sure you have a good outcome. That's it back to provide you feedbacks. So please start asking your questions. Remember, immediately after this clinic, I'm going to go to Facebook and repeat this same topic. If you have a friend, a sister, a colleague with polycystic ovarian syndrome going through infertility, invite them. Right now, the clinic is open. Please, I want everybody in the clinic right now to ask questions. Everybody, COO, moderators, Dr. Ndiche, everybody ask me at least 2 questions. Let's use this opportunity to learn, okay? So please start asking your questions. Remember the event we have on the 28th. You don't want to miss this event. It's a mega masterclass. IVF, IUI, surrogacy, mega masterclass. Registration is open. Go and register. Please start asking your questions. We have quite some number of people in the clinic. So it's time for your questions. Thank you, Josephine. Thank you, Ruth. Thank you, Tosi. How do one know if she's ovulating with polycystic ovarian syndrome? Which drug can cure PCOS? So, Dr. Ndiche, we have to be mindful about the terminology. I know you asked this specifically for diplomatic purposes. Now, polycystic ovarian syndrome cannot be cured. It's a condition you will have throughout your reproductive phase of life. It's not permanently cured. It can be managed. So we can use the fertility drugs I mentioned, which, based on the demographics of our community, we're not going to mention the names, but there are some specific fertility drugs, which can be oral, which can be injectables, which can be suppository, we can use to induce your ovulation. So first of all, if you have polycystic ovarian syndrome, we have to check your ovarian reserve to confirm you have ovaries, to confirm you have eggs. So once we confirm you have eggs, the next thing is to give you the drugs that will induce your ovaries to give us a lot of eggs. So when we are inducing your ovaries, we want to achieve what we call super ovulation. We go to the ovaries, we give the ovaries an opportunity to release all the eggs they can release in that cycle. That's a very technical question. How do one know if she's ovulating? The same technique. So you present yourself to the gynecologist, we collect your blood sample, and we check your progesterone level on day 21. We can also run some ultrasound to check your follicles. And we can also check the other hormones. And some women can present with non-specific symptoms of ovulation. So to confirm if you're ovulating or not, we need to do a blood work. That's exactly, I can now see where Dr. Ndiche is coming from. It can be managed. It cannot be permanently cured. Now, if you modify your lifestyle, you exercise, you eat good food, you avoid stress, you are not overweight, you can actually have a lot of advantages before you go into menopause. But it's not a condition you can completely cure. It's not completely permanently cured. We can manage it and you can become pregnant and have your baby. The hairs in your leg are not counted. It's the hairs in your face and your chest. That's supposed to be for men. So some women can inherit having hairs all over their body, including their legs. We are not looking at the legs. We are looking at facial hair, chest hair, because that's the place that will manifest as a man. The reason why you're having all those hairs is because the level of your testosterone is high. So leave the leg alone, okay? All right. Now, remember, the problem in polycystic ovarian syndrome is why you are not ovulating. Okay, so if we correct that, then we can get some quality egg. So it's not a case of direct impact on your eggs. It's a case of not ovulating because the follicles are being suppressed because your testosterone is high, your estrogen is not within normal range, your FSH is not within normal range, your LH is not within normal range, so you are not regularly ovulating. But if we can suppress the hormones and we regulate your body, you can ovulate and we can have quality eggs. Do you understand my logic? The problem is you are not ovulating because the hormones are messing your ovulation up. So if we correct that and we induce ovulation, yes, we can have quality eggs and we can succeed in getting you pregnant. Can you go on Google and take medications? Come on now, Dr. Ndiche. The worst thing you can do for yourself, and I'm telling this to everybody out there. I know we can easily go to Google and type your symptoms and you think you're smart. Don't do that. There are things we call differential diagnoses. Matter of fact, polycystic ovarian syndrome is a diagnosis of exclusion. So what do I mean by that? You can present with lack of bleeding. It can be a different thing. It can be hormone imbalance. It can be endometriosis. It can be due to a couple of other things. You can present with pain. It can mean a lot of things. You can present with discharge. It can mean a lot of things. So in medical practice, there are two types of diagnoses: differential diagnosis and definitive diagnosis. So differential diagnosis means other things that can cause this. So we have to rule out everything else until we finally arrive at polycystic ovarian syndrome. This is why I mentioned three things. We have to check your blood, and we have to notice you have increase in the testosterone. We have to notice you're not ovulating. We have to notice the polycystic ovary before we can make the diagnosis. So please don't go to Google. You are gonna damage your chance. There are some people that don't consult the doctors until they mess themselves up in Google. Then they will now come back. When your body is messed up, you want us to fix it. Don't go to Google. Anybody can go to Google and dump anything there. Dr. Ndiche, you know that already. Can a woman still get pregnant with PCOS, or is IVF the only option? No. Remember, I followed a sequential approach. Some women can become pregnant simply by taking the fertility medications. Some women can become pregnant by losing their body weight, especially in 10% range. Some women can become pregnant by removing stress. But if the medication fails, your body weight fails, removing the stress fails, then we begin to think about IVF. So IVF is not the only option. There are some women that will even have polycystic ovarian syndrome. They will complete their family without even knowing. Okay? Is it hereditary? To an extent. There are some strains, there are some school of thought that believe that polycystic ovarian syndrome can be hereditary. So what do I mean by that? If your mom had polycystic ovarian syndrome, the possibility you and your sister will have it is there, though limited. And it can also develop spontaneously in any woman. Can you do liposuction to, come on now, what's going on with Dr. Ndiche this evening? Now, liposuction, let me tell you the truth. When you start, you can't stop. And there are so many medical risk factors. There are some women that didn't come back. You can do this by yourself. If you are disciplined, you can lose the body weight you don't need. What you need to do is to work on what you eat. The biggest impact on your body weight is what you eat. So even if you're not able to exercise, but you eat the right things, you will have a normal body weight. So liposuction is not in my list. I will not recommend it for any woman. It's a plastic surgery that women do for aesthetic purposes. And once you start, you can't stop. And it's very expensive and a lot of complications and a lot of fake people that give all this stuff. And so many women end up dying or messing themselves up. So we don't recommend such in our group. What can make testosterone level high? So by default, they can be iatrogenic. They can just happen by themselves, and it can also be due to lifestyle. So there is something we call aromatization. So aromatization is converting one hormone to the other. So if you're attracting a lot of fats, a lot of body fat as a woman, if you're not eating properly, if you have a lot of stressors, they will begin to convert your estrogen to testosterone. The same thing can happen to men. Men ordinarily should have more testosterone. But when men are accumulating a lot of body weight, that's why some men will develop gynecomastia. What's happening? They are converting their testosterone to estrogen. So in a man that is obese, a man that probably have infertility, a man that probably have poor sperm quality, when we do the analysis, we will notice that the man will have higher level of estrogen because there is conversion of the testosterone to estrogen. The same thing will happen to women. When you convert your estrogen to testosterone, it begins to be a problem. I love that question from Kenny. I don't know where this lady gets all these questions. Very tough question. It feels like I'm in medical school again. If a woman with PCOS successfully gets pregnant, is she likely to develop gestational diabetes? She has a higher probability of having gestational diabetes because of the insulin problems. But it's not a must she will have, this problem. But if she becomes pregnant, that pregnancy is going to be treated as high risk. Remember, diabetes, we have two types: insulin-dependent diabetes and insulin-independent diabetes. So it's not a must, but compared to a woman without polycystic ovarian syndrome, the woman with polycystic ovarian syndrome will have a higher probability, a higher chance of having gestational diabetes. The beautiful thing about gestational diabetes, once your pregnancy is over, you can stop having that diabetes if you modify your lifestyle properly. There are some women that will now continue to have diabetes after gestational diabetes. So it depends on your lifestyle modification. I'm loving all the questions this afternoon. Happy weekend. Polycystic, okay, I've already answered the hereditary aspect. It can be hereditary, but not all types. It can also happen spontaneously. It's not contagious. It's not an infectious disease, okay? So you can't pick it up from someone. It's not. Okay, I love these questions. You are 7 weeks pregnant. You went for early transvaginal. That's too early. 7 weeks is too early. They saw the gestational sac. The doctor said it could be blighted ovum. You have polycystic. So my sister Magdalena, what you need to do is to go for follow-up. Personally, 7 weeks is too early. So it's possible you didn't get your last menstrual period correctly. So go back and let them repeat this test in 1 week or 2 weeks' time, okay? If you're pregnant, you're pregnant. If you're pregnant, we'll see the gestational sac. Unfortunately, if you're not pregnant, we won't see the gestational sac. So we have to have a repeat scan in about 1 or 2 weeks' time. Hopefully by then we'll see your gestational sac and you can go ahead and start attending your ASC. Guys, we seem to have a little more leeway for time, so keep asking your questions. Remember, we had problem with the other stream. So if you still have questions, feel free to ask. Keep asking your questions, please. Beautiful questions this afternoon. I love them. Okay? If you have confirmed polycystic ovarian syndrome, please, you need a fertility specialist. It's very important. The only thing you can do for yourself is to work on your body weight. But other aspects of management, we must come in. We must give you the appropriate fertility medication. We must see if you're a candidate for IVF. You can't do this by yourself. But if you lose your body weight, 10% loss of your body weight will improve your fertility markedly. Okay? All right. Nobody should go for liposuction. PCOS is not permanently cured. Go the normal stepwise way. Work on your lifestyle. Avoid stress. Drink a lot of water. No alcohol. No smoking. Work on your body weight. Eat a lot of fruits. Eat a lot of vegetables. Avoid all those takeaways. Prepare your own food. Avoid fast foods. Fast food will kill you faster. Trust me, if you do all this, endometrium is the cover of your womb. This is called the endometrium. These special, beautiful cells that cover your womb is called the endometrium. Okay? All right. Admin, if we are all good, give me signal so we can transition to Facebook. Are we all good? Can we all give me a thumbs up if we've exhausted all our questions? I know so many of us are prayer warriors. Please keep praying to Facebook so they will release our page. Our page is still restricted. That's probably why so many of you are not seeing me. Okay, we're good to go. Stomach hotness before your menses might be a sign of PMS. Okay? How likely is polycystic ovarian syndrome associated with blighted ovum? They are not associated. They can happen independent of each other. Okay? All right, guys. Join me in Facebook. How many of you have registered for the upcoming mega masterclass? Mahanali, I'm sure you've registered, right? Tosi, I know you've completed your family bar. Remember, you told me you're going to start having babies in 2024. Make sure you register. Only 100 people will attend, though. Only 100 people. Okay? All right. So, guys, thank you so much. Please give me a few minutes and we'll continue the conversation in Facebook. Admin, thank you so much. Dr. Ndiche, thank you. COO, thank you. Chinyere Onyi, Mahaneli, Magdalena Omotunde, Tosi, who again? Who again? Josephine, and who again? Guys, I'll see you guys in Facebook. Thank you so much. God bless you, and bye-bye for now.